Hey everyone, welcome back. Today I want to make a video on signs that you might want to think about seeing a therapist. Stay tuned. Now, I don't want to undersell it. I think that the decision to go see a therapist is a really hard one for most people. I think this has a lot to do with the fact that our society still highly stigmatizes mental health. And so when people make the decision to get therapy, it's usually when they hit like a rock bottom. And this really shouldn't be the case. And honestly, like when people start to feel maybe a little bit off, they're more than likely going to go see their primary care physician first and maybe ask for some medications just to not go to therapy, because there's a lot of reasons why this is still stigmatized. Sometimes people don't even want this in their medical record because they're afraid of what people are going to think of them. So I want to talk about 7 actual signs that you should see a therapist, and they might be a little bit different than what you think they are. So jumping in, number 1 is that life is starting to feel a little uncomfortable. So instead of waiting to seek therapy as a last resort, try to seek it when you're just starting to feel a little bit uncomfortable, because really the earlier on that you can catch a potential issue that arises, the better the outcome is going to be. If there's been some kind of shift, maybe in your mood, maybe in your focus, just something is not feeling quite right. Dealing with things like anxiety and depression are much easier to treat when they're dealt with really early on. And if you're feeling depressed or anxious, waiting for these issues to resolve on their own is really harmful and can actually lead to them getting worse. Like medical conditions, mental health conditions get worse the further you go without treatment. So the earlier you can get in to receive treatment, the better the outcome is going to be. Number 2 is a major life change. Have you lost a job recently? Have you gotten a divorce? Have you lost someone? Like something significant has happened in your life that has made it change greatly. And this is because loss entails grief, and grief is best explored with the support of somebody else. A trained therapist can help you explore your feelings of grief and help ease the burden by implementing healthy coping skills on how to handle loss and change. Changes can breed mental health conditions. And you really honestly don't have to go through this alone. There are a ton of trained professionals out there that would love to help you. And this can really help ease those burdens that you're feeling. Number 3 is that you've had a traumatic experience. Now, trauma can be really hard to be open and vulnerable about. I don't want to undersell that either. It is really hard to be vulnerable about your trauma, especially to someone that is a complete and total stranger, which is who your therapist is going to be when you initially go in. We're strangers. Like we're asking you to tell us your deepest, darkest secrets. It's not easy. And depending on the type of trauma, there can be a lot of like self-blame, there can be a lot of guilt, a lot of shame, a lot of really uncomfortable emotions. However, the earlier that you're able to open up about trauma, the earlier it can be worked through and processed and resolved. A trained trauma professional can really help you navigate the healing process and really help ease that emotional repression that tends to happen to people that have been victims of trauma. Number 4 is that you find yourself using negative coping mechanisms. These are things like substances, sex, shopping, gambling, self-harm. Those are all coping skills that we refer to as maladaptive coping skills. And if you find yourself using these types of coping skills to help you, then it might be an indicator that you might want to see a therapist, because a therapist can help teach you healthier coping skills, how to better help with pain that is not going to be so damaging to you in the long run. The facilitation of learning positive coping skills can really help that downward spiral and help you have a better, healthier response to the things that are going on in your life. Literally, it can save your life. Some of these things can be really lethal, and they tend to get worse over time when they're left untreated. Number 5, you're having thoughts of wanting to end your life. So there's 2 different types of suicidal thoughts. There's suicidal thoughts referred to as passive suicidal thoughts, and then active suicidal thoughts. And passive suicidal thoughts are kind of thoughts related to, it would be okay if I wasn't here, or if I didn't wake up tomorrow, I would be okay with that. Things would be less painful if I just didn't wake up tomorrow. Active suicidal thoughts imply intention and a plan. So when someone has active suicidal thoughts, they are thinking or taking steps to actually end their life. So they're thinking about how they're going to do it, what they're going to use. They make final preparations It is something that they are intending to eventually act upon. If you are experiencing the passive kind, it is definitely time to reach out for some help. Passive suicidal thoughts can very easily start to become active suicidal thoughts. So if you're experiencing thoughts around how nice it would be to not be around anymore, how much pain will go away if you didn't exist, that it would be okay if you didn't wake up or if someone hit you while you were walking or driving in your car, passive suicidal thoughts, it is time to call a therapist. If you are experiencing active suicidal thoughts, call a crisis line, call the police, and go to the emergency room. If you're refusing to do any of those, please call someone that you trust, someone that you're close to, and let them know exactly where you're at so that they can help you out. Because this is indicating that there is something in your life that is causing you a lot of pain, and it is time to work through that. Okay, there are other options to stop pain that don't involve ending your life. I want you to hear that part, and I really want you to hear that crystal clear. It is always figure-outable. You do not have to end your life to stop pain. Reach out as soon as possible. It is so important. If you need ideas of crisis lines you can call, please look in my description box below. I always list crisis lines, including the National Suicide Hotline. Number 6, are things that matter in your life are starting to suffer. Are things starting to go sour for you at work? Or if you're in school, are your grades starting to slip? Are you not getting as much enjoyment out of your interpersonal relationships as you did before? Or your hobbies that you used to enjoy before? Are they starting to kind of feel like either like a burden or just feeling like a lack of motivation to do them? These can be signs of depression and also can continue to grow and cause major interference in your life. So this would be a good time to seek out therapy to kind of find out what's going on there. Number 7 is that your friends and family suggest you go see a therapist. Now, I'm a very firm believer that for therapy to really work for someone, the person seeking therapy needs to want it. They have to make the choice to go and absorb the information and practice the skills or practice whatever it is that your therapist wants you to do. But sometimes there are different levels of insight. And sometimes our loved ones can notice things about us that other people might not notice about us. And if someone that you're close to and that you really trust is telling you, hey, you really haven't been yourself lately, I'm worried about you, maybe it's time to talk to someone about this, someone that's a professional. That could be a sign that maybe something is going on that you could either be in denial about or just really lack the insight to see. You might feel a little bit off, but maybe you just don't know how much things are slipping for you. And the people close to you can see this a little bit clearer at this point in time. Sometimes we do need a little push. And that is a thing. We just need someone to kind of give us some tough love and kind of be like, hey, you know what? I'm worried about you. You know, the things that you're doing right now, they don't seem healthy, they don't seem good for you. How about getting some help? How about talking to a professional? Trust that. You know, and if it's something that's really scary to you and this person cares, you know, ask them to come with you. You know, you don't have to face this alone. There are other choices and options. Well, that's going to wrap up the video for today. I hope you found it useful. If you liked it, give it a thumbs up. If you like videos like this type of content, hit the subscribe button. I release new videos every single week. I'm Jenna. I'm a licensed therapist. Thank you for watching and have a great day.